Good morning, YouTube family and friends. Hope your week is going okay. Today is Thursday? Yeah, Thursday morning, September 26th, I believe, 2025. And I wanted to provide you with a little update. If you watched last week's video, I know it was a long one, it's over 40 minutes. I do apologize for that, but once I started talking, I just had so much to get off my chest. It felt good to talk about. It kind of helps with my anxiety and depression stuff that I've been dealing with for several months now. Anyway, I had talked about I was worried that I was losing too much weight in a too quick period of time without really trying. And so I didn't know if it was nothing to worry about, because it might have been caused by medication. The psychiatrist I started to see a few months ago has been trying to get me on medication, the right type of medication, the right doses to help with my anxiety and depression and stress and whatnot due to all my medical issues, the stress of work. And so I'm also seeing a therapist, and therapist says it's a psychotherapy treatment. But anyway, if it was either that, something simple as that, nothing to be worried about, or with me having liver cirrhosis and compensated but borderline decompensated, because my liver's still functioning like it's supposed to, but I do have portal vein hypertension, which has caused an enlarged spleen and a small varices in my esophagus. So I am still considered compensated, even though usually when you have portal vein hypertension that has already caused an enlargement of your spleen and a varices to appear in the esophagus, I think they call it esophageal varices. That's usually in decompensated. But my varices isn't bleeding; it's just small. Well, 2.5 years ago, it's the last time I got it checked. I get an endoscopy and a colonoscopy now every 3 years, and so that's coming up here next year, early on. So since it's not bleeding yet and my liver's still functioning, I'm still considered in the compensated liver cirrhosis stage, but that can turn in a heartbeat. And of course, due to the scarring in the liver, due to with the cirrhosis, there's a high probability at some point of developing cancer in that liver due to the scarring. And not to mention, I have all kinds of cancers in my family, on both sides of my family. So, with me dealing with all these other issues, I was, my mind went to the worst case scenario, and I was really, really, really stressed, and gave me a lot of anxiety worrying about it. So I went ahead Monday and messaged my liver doctor just to let her know, because she always says if I have any changes at all to my health or something's going on, even if I don't think it's related to the liver, I need to let her know that so she can make a determination whether or not it's something to be concerned about or something to check out. So I sent her that message, and she did reply stating, I know you have your ultrasound coming up next week. I do, my 6-month ultrasound that we have to check things out, make sure they don't see any cancer developing on that liver, and check my spleen, and just check there's no fluid buildup in the stomach, which would be ascites. So she said, even though that's already scheduled, she wanted to be safe and do new labs. She wanted to just have the standard liver lab done, draw blood, and then she also wanted to do a tumor marker and that checks for protein in your blood. Because if you have cancer, a lot of times different types of protein can develop in your blood at higher levels. And so she wanted to check that out. And she wanted to do a new MELD score. So I haven't had a MELD score done in a few years. The last time I had a MELD score done, it was a 6, which is the very lowest number you can have on that scale, which means that you're still in the beginning of end-stage liver cirrhosis. So, which is good to be at the very beginning. So she just wanted to check all that out just to be safe. I'm still doing my ultrasound next week. So I'm actually going for my walk. It's such a gorgeous day already. I decided to go ahead when I got up to go ahead and go for a walk. So that's what I'm doing. You can see I'm just on a walking path around my neighborhood near the lake. The lake is over there. So, but anyway, now I love how I bruise. I don't know if you can see that or not. It's kind of hard for me to see with the sun glare on my phone, but yeah, I got a bruise there. I usually bruise when they draw blood. I didn't think I would this time because she got it in one spot. Usually the veins in the middle of the elbow, they're deep and they move. So a lot of times they can have issues trying to draw blood from me. And sometimes they have to poke and move it around and re-poke. But she got it on the first try. So I got the utilities truck driving by. But so yeah, I got that done. Got the new labs done Tuesday, and it's given me. I got the results back already, and it's giving me some relief. She said that my labs for just my liver numbers, my enzymes, all look good. Everything's still in normal range, except of course for my platelet count, because with the enlarged spleen, it pulls more platelets out of the blood than it should. And so my platelet count just had a web. Walked in on a web. I hate that. Hear the geese? I don't know if you can see that or not, but there's all kinds of geese around this lake and ducks. And there's sometimes you see an eagle every once in a while, not too often. You mainly see, I forget what they're called, but they like to hunt like the squirrels and stuff. So, but anyway, so yeah, those numbers come back. My platelet count dropped again from the blood work I had done last month. Last month it was at 118, and this time it was at 116. So it just dropped 2, but it's still above 100. As long as that platelet count stays above 100, I'm okay. My blood will still clot okay. It needs to be above 140. That's the bottom of normal range, is 140. So I'm at 116. So, but as long as it stays above 100, we're good. My MELD score again was a 6. I'm still at the very, very bottom, which means I'm still just at the beginning of end-stage liver cirrhosis. So which gives me a very, very low probability of dying in the short term. Like the term they say is 3 months. So I'm not going to die in the next 3 months, at least from the liver. So that's good. So everything. Oh yeah, and the tumor marker showed the levels are in normal range. So I shouldn't have to worry about cancer. Of course, that's not guaranteed. I'm sorry, we have they're digging a big old hole over there. We don't know what the heck they're doing over here. The power plant, the coal power plant is down the way, and this is their land, but we don't know what's going on. They're just digging a big old hole. Let me get a view of it. So none of us in this neighborhood have a clue what they're doing. So I'll let this truck go by. So I have to cross the street. See, over there is our coal power plant for the city of Council Bluffs. So the Lake Manawa is just right over there beyond those trees. And this is like a walking bike path, but I'm gonna take this one to go back to my neighborhood is right over there. So, but anyway, yeah. So this has eased my mind some. No, I still gotta wait to get the ultrasound done. That's when I'll be eased even more, because I have been reading that you can have the very low MELD score, but that's just, it's not an indication for everything that goes on with liver cirrhosis. I can have a steady MELD score, you know, means it's holding steady, but my liver cirrhosis could still be progressing. The MELD score might not change and pick it up, so I'll have to wait until the ultrasound to be completed to ease my mind fully that, okay, my liver is still holding steady, it's not progressing. I'm a little concerned because I have been getting pain again, not major pain, but just discomfort pain. So I was holding the phone close to my head so you could hear me over the noise of the semi trucks, the dirt haulers from that big old hole over there. But anyway, yeah, forgot what I was talking about now. Oh yeah, so the liver cirrhosis could still be progressing. So we'll check to see what the liver looks like, if it's getting more scarred. We'll check the portal vein hypertension to see if the pressure has built up even more, which would indicate that the blood flow is being more restricted going into the liver, which is causing like a traffic jam. It backs it up, which causes the it's called splenomegaly, where you have an enlarged spleen. So it could cause when the blood backs up, because it can't go into the liver fully, it backs up like a traffic jam, and so it backs up into the spleen, which causes it to be enlarged. And then also the blood has to find other paths back to the heart. So that's what causes the esophageal varices that I have due to the liver cirrhosis. So yeah, so even with a good MELD score doesn't necessarily mean that my cirrhosis is holding steady. It's not progressing. So even though, as I said, the blood work and tumor marker tests ease my mind some, it won't be fully eased until we do the ultrasound next week and confirms it even more that everything's holding steady, nothing's progressing. So I'm trying to think positive, but sometimes my head, especially lately, last few months, with my major anxiety and depression and stress, I tend to think worst case scenarios. I'm trying not to do that. That's one of the things I'm working with my therapist on, is don't go to the worst case scenario, especially with all my health issues. You know, the liver cirrhosis from non-alcoholic fatty liver disease. I have generalized myasthenia gravis that I was diagnosed with in July of 2024, so last year July. I'm a type 2 diabetic, but that's been my A1C, my blood sugar levels have been under control for many years now with the help of Mounjaro. I have sleep apnea that I've tried all different things that don't seem to work. So back in March, I had a surgery to implant the Inspire device. It's a nerve stimulator, but when I sleep, I turn it on, and every time I take a breath when I sleep, it stimulates that tongue muscle to move forward, so it can't lay back when I sleep and block my airway. So I'm still trying to figure that out, because I'm having trouble sleeping the last few weeks. I don't know if I'm not high enough on the setting with the nerve stimulator, the Inspire device, or maybe I've gone too high and it's starting to have the opposite effect, or if it's due to the medication I'm on right now from I had been on, then she switched my medications a week ago. But all the side effects of these medications can be, they make you tired, but they can also have an opposite effect of making you have trouble sleeping. So I don't know if my trouble sleeping is just from the medications, which hopefully it is, because I was starting to sleep better, but it wasn't fully better. So I went up 2 more levels on the Inspire device. I'm at level 9 right now. And I'm supposed to have a sleep study done. It just got scheduled for November 18th. So I still have almost 2 months before I get sleep study done. But the doctor wanted me at a level, minimum of a level 8 for a while before I had the sleep study done. So I don't know. I thought about going back down to level 8 to see if I start to sleep better. If I don't, then I know it's from the medication and not my actual sleep apnea. So I don't know. That's one thing. All my different medical issues have symptoms that can coexist. No, they can all create the same. There's some symptoms that can be caused by multiple things that I have. So it's hard for me and my doctors to know for sure what's causing different things, because it can be caused by the different medical issues that I currently have. So yeah, it's no fun. So anyway, oh wow, this video is 16 minutes long already. I was hoping to do like a quick 5-minute video, folks. I'm sorry, I just can't do a short video. You know, once I start talking, I want to make sure I give you all the information that I have, especially for my family members, close friends that I have that are following my journey here, and they like to have these updates so they know how I'm doing. So I want to make sure that I provide all the information. And unfortunately, time goes by super fast when you're talking. Look, I've talked about this and it's already past 17 minutes. So, all right, I'm going to cut it off there, folks. I'm getting close to being back home again. There's that's one of the 2 entrances to our neighborhood, and you see the dirt trucks heading over that way where the big old hole is being dug. We've been dealing with that for this whole summertime. Those dirt trucks are it puts a bunch of on our streets and in the air. It's already bad in this neighborhood because we got the coal plant right next to us, pretty much. And so it's impossible to keep the house clean, keep the cars clean that are parked outside and not in the garage, because all the coal dust in the air. And now to throw in all this dang dirt that gets on the streets and gets in the air, it's just, it's irritating. I'm constantly washing my car because I park on the outside in the driveway. So, but anyway, I'm gonna quit talking now. So it's at 18.5 minutes right now. So if you watch this video through it all, I really appreciate you. Thank you for following my journey. And if you would, do me a favor and hit that like button. And if you're not already subscribed to my channel, please go ahead and hit that subscribe button. And if you want to get notified when I post my weekly videos, usually I just do 1 video a week, but every once in a while, like this video, I'll post an update during the week if I feel like it's necessary. And that way I don't have to try to avoid a long video when I film it on the weekend for my weekly videos. So, but anyway, I hope you all have a good rest of your week. And remember to live life to the fullest, because you never know what life is going to throw at you. I'm living proof with all my medical issues. So, but I'm still trying to live life to the fullest. So y'all take care. I love y'all, and you have a good one. Bye-bye.